Hi, this is Dr. Michael Aboud. I'm an OBGYN practicing in the state of New York. I have interest in hormone disbalances, and I attended a fellowship in metabolic medicine. On average, humans reach their ultimate hormone level by the age of 25, after which there will be a steadily decrease in hormones. It's proven in a male patient that testosterone will be decreased by 1% after the age of 30, and that might lead to erectile dysfunction. Talking about females, menstrual irregularities as well as weight gain, hard to concentrate, sleep disturbances, and then when it become perimenopausal or menopausal, hot flashes and depression might take place. What usually a patient does, they go to their health care professional who usually does a blood test that includes a hormonal profile. Hormonal profile usually comes back as negative. For example, testosterone, I'm just taking numbers. Let's say testosterone is normal between 100 to 200. So if your testosterone level comes as 101, so you are normal. In reality, that's not the truth. What you need is something called a saliva test. A saliva test is collected over 24 hours at 4 different times separately and will assess your hormonal levels. In a female, hormones that control the menstrual cycles are 2, estrogen and progesterone. Hormones that control the cycles are estrogen, that controls the first part of the cycle, that proliferates the cells, and if there is no pregnancy, then the ovum goes through the tube into the endometrium and is being shed as a menses, and that is part of the progesterone job, which is cell shedding. So you need to go and see a hormone specialist. The hormone specialist will take a look at you in whole. There will be a physical exam. They will get to know you, and then, as I said, a saliva test will be conducted. My patients, when I tell them about hormone replacement therapy, I just see their eyes widely open and they're scared of cancer. There are 2 types of hormone replacement therapy. There is the synthetic hormone replacement therapy that is taken by mouth, and the moment you put that pill into your mouth, it goes through in a cycle that's called first pass effect that could trigger clot factors to be activated and create a clot and a brain problem. The second thing, when you're taking a pill through the mouth, there will be an increase in sex hormone binding globulin that will decrease testosterone, and that decrease in testosterone will create problem with the thyroid, and that means people will gain weight. Remember, when we were talking about the menstrual cycle, we talked about estrogen as proliferative measure to increase the size of the cell, while the progesterone literally kills the cell and sheds it. When you're taking hormones by mouth, there is no progesterone. It's called progestin, and there is a big difference between both, because progestin does not oppose the effect of estrogen, and that's why there will be an increase in the size of the cell that could lead to cancer, and it could lead also to breast cancer, because the endometrial tissue is very similar to the breast tissue. As for a male patient, would testosterone supplement increase the risk of prostate cancer? The answer is no. If there is a prostate cancer, it might fuel it. But if there is no prostate cancer, there is no risk at all. Basically, when you're taking testosterone, some of it will be turned into estrogen, and that estrogen in somebody's mind might lead to increase of cell turnover and create a cancer. In reality, you start with a baseline PSA level and frequent digital exams and liver function tests, and you are safe.